Hi, I am Allison, and I looked at the use of self-care heart failure index to reduce hospital readmission rates in people with heart failure. So, heart failure is a progressive disease that is complex to manage. It includes lifestyle changes such as exercising, limiting salts in the diet, as well as monitoring fluids and weight for weight gain, and monitoring for fluid volume overload and the symptoms associated with that. According to the American Heart Association, over 8 million people will be diagnosed by the year 2030. It is currently the most common cause of hospital readmission in people over age 65 and is defined as right or left, systolic or diastolic, and can result from high blood pressure, heart disease, and valve disease. So I am a nurse on a cardiovascular floor in a major hospital south of Boston. In my nursing education, I was taught to provide what we call patient-centered care, patient-focused care. Essentially what that means is providing patient care specific to the patient. For example, you're not going to check a blood sugar on a patient that doesn't have diabetes, just as an example. And I provide a lot of patient education because nurses spend the most time with patients. And some studies have shown that patients benefit when the nurse is able to identify education and self-care needs. So I finally decided on the question, does the use of a self-care heart failure index tool to identify self-care deficits and focus education needs lead to reduced hospital readmission rates in people with heart failure? So what is the Self-Care Heart Failure Index? By the way, shout out to the OT department at South Shore Hospital for providing this for us. It is a 22-item questionnaire that measures self-care management, maintenance, and confidence. It uses a Likert scale where rarely or never is scored with 1 point and always or daily is scored with 4. And these scores are totaled, and higher scores indicate better self-care. As you can see, this first section asks questions regarding management, section B about maintenance, and section C here at the bottom talks about confidence. I'll give you can kind of see about how likely are you to reduce salt in your diet, how confident are you following the treatment advice, things like that. So quick lit review. Self-care management tools lead to improved self-care and quality of life. This is awesome. Lack of knowledge about self-care leads to decrease in self-care behaviors purely because patients or clients are not aware that they need to be doing these things, and therefore it increases readmissions. So that's a huge deal. If we can close knowledge gaps, we can hopefully decrease readmissions, which is what I'd like to do. The Self-Care Heart Failure Index has been used to measure self-care behavior change in multiple interventions, such as motivational interviewing, as well as providing educational printed materials and providing a DVD. The Self-Care Index was provided prior and post-intervention, at which point self-care behaviors did change due to the education. So methodology. After I obtain IRB approval, which by the way we will be respecting all of the ethical considerations stated in the Belmont report, including respect for autonomy, beneficence, and justice. We will include every patient admitted to the hospital with heart failure, except anybody with a new diagnosis, anybody with dementia, and any nursing home residents, as people with dementia and nursing home residents kind of have a lot of these self-care items taken care of. People in nursing homes don't really get to choose what they eat, therefore, maintaining a low-salt diet might not be in the control of the participant. The control group will receive general nursing education, while the experimental group will complete the index, and the nurse will focus the education specific to the patient's needs. Example, if the patient is not likely to weigh his or herself, the nurse can identify the barriers that are keeping the patient from doing so and hopefully close that gap. If the patient needs more education regarding diet and the nurse is unable to answer those questions appropriately, the nurse can also seek out the resources such as having the registered dietitian come in and answer those questions for the patient as well. So I'm planning it to be a 3-month intervention period, although it may need to be longer. In order to get the appropriate confidence interval, I will need a sample of at least 385 subjects. The unit on which I work, where I would be trying to get approval to do this study, is about a 50-bed unit. And the majority of our patients do have heart failure, so I don't think getting this sample will be difficult. However, it could take longer. So following consent, the patients will be split up between the control and the experimental group. The control group, I've decided, will be everybody born in an odd number of year, and the experimental group will be everybody born in an even number year, just to keep it easy. At which point we will measure days until readmission or death if the patient happens to pass away during the course of the investigation. I would like to compare the descriptive statistics as well as complete a two-tailed t-test in order to prove whether or not giving the my intervention, which would be giving the self-care heart failure index, is superior than general nursing education. And I have decided to assign a confidence interval of less than or equal to 0.05. So scientific contribution. Nurses should be using this to identify education and self-care needs in the inpatient setting in order to focus their patient-centered care onto the patient. And of course, if we can reduce readmission rates, we can increase quality of life for our patients, and the hospitals will save some money, which everybody knows in our current economic situation. If a hospital can save a penny, they're like saving a life. So I hope you enjoyed hearing about the Self-Care Heart Failure Index, and I look forward to any input you guys may have. Thank you.